Stovall, and I'm here with Dr. Will from the Boonshoff School of Medicine talking about Prozac. What can you tell me about Prozac today?
Prozac is a selective serotonin reuptake inhibitor that is most commonly used to treat depression. It most commonly comes in green and white capsules. It is typically prescribed for 10 to 80 milligrams a day and is not recommended for people under the age of 7.
Besides depression, does it help with any other issues?
Prozac can also be used to treat obsessive-compulsive disorder, bulimia, and panic disorder.
Doctor, what are the common side effects and drug interactions that you need to be cautious of?
Common side effects are nervousness, nausea, dry mouth, sore throat, drowsiness, weakness, weight loss, sexual dysfunction, and excessive sweating. It is also important to avoid taking Prozac with monoamine oxidase inhibitors because this can cause serotonin syndrome, which in some cases has led to death. Also avoid drinking alcohol as this may increase drowsiness.
Are there any signs to be aware of that signal an overdose?
Signs of an overdose are unsteadiness, confusion, unresponsiveness, nervousness, dizziness, rapid heart rate, hallucinations, fever, fainting, and possibly coma.
Should you take Prozac if you are pregnant or breastfeeding?
Consult your doctor before taking Prozac while pregnant to weigh the benefits and risks. Taking Prozac while breastfeeding is not recommended.
When stopping Prozac suddenly, what may happen?
Withdrawal symptoms such as mood changes, irritability, agitation, dizziness, numbness, or tingling in hands and feet, anxiety, confusion, headache, tiredness, and difficulty in falling asleep may occur. To avoid these symptoms, the patient should have their dosage gradually decreased and gradually taken off.
Thank you, Dr. Will. Now I hear you're going to talk to one of your patients on Prozac. Let's bring her up.
This is my patient Kayla, who I prescribed Prozac for to help her with her depression. Kayla, how long have you been on Prozac?
I've been taking it for about 6 weeks now.
How long were you on Prozac before you noticed a positive change in your depression?
It took about 4 weeks, and then I noticed I started to feel much better. My mood was significantly more positive, and I started going out a little more and started sleeping better from the decrease in stress.
That's great news. Have you noticed any side effects?
Just the occasional dry mouth during the day, but nothing too serious.
Do you think Prozac is easy to take on a daily basis?
Prozac is very easy to take. I just need to remember to take it every day at the same time.
In closing, do you have any advice for anyone thinking about starting Prozac or who have just started Prozac?
I would recommend it to anyone taking Prozac to stick with it and not become discouraged if you don't see results right away. Also, until you are aware of how the drug affects your body, avoid driving or operating machinery. If you have any questions, never be afraid to call your doctor. That being said, I highly recommend Prozac to those it applies to.
That all sounds great. Thank you so much for your time, Kayla.
Thanks.